Welcome to PrEP Aware Week 2025. We're excited to have a whole week of celebrating PrEP education to spread the word about this amazing resource to help prevent HIV. And we have a great panel here that over the next half hour or so, we're going to be discussing PrEP and some people's lived experience and just a little bit more information about what PrEP is for people who may not know. So I'll get it started and I'll be moderating. My name's Nathan. I'm the communications director here at Trillium Health in Rochester. And let me introduce the panel. We have Jeff from New York City, who is one of our statewide 2025 PrEP Aware Week ambassadors. So Jeff, we're excited to have you learn from your perspective. And then from Trillium Health, we have a number of my colleagues. We have Shane, who is a clinical pharmacist in our clinic here in Rochester. We have Ember, who is a case manager here that helps connect people with care. And we have Terrence, who is our director of our MOCA Center, which also is a wonderful community resource to connect people to care. So thanks for being with us to have this discussion today. And I think, Shane, I'm going to start with you because for people who aren't aware of what PrEP is, just kind of give us the rundown of what it is.
Sure. So PrEP, if you don't know, it stands for pre-exposure prophylaxis. Prophylaxis just being a fancy word for prevention. So PrEP is a medication to prevent HIV transmission. Anybody who feels that they might be at risk for HIV transmission through whatever means, they can, if they feel like a continued risk and they want to be on PrEP, they can get on one of the PrEP medications.
Perfect. And Jeff, I think we're going to go next to you. You have an amazing lived experience and just so much invaluable perspective, I think, to this discussion. Obviously, you, I think, out of all of us, really the only one that in this group that really lived through the very beginning of the HIV crisis and have seen firsthand how this has progressed over the years. Talk a little bit about your experience going through that and how that really makes PrEP so much more meaningful.
Yeah, thank you. I'm 78 years old. And I was out and having queer sex, male sex in the 70s, when before there was any clear nature that HIV was around. Although I've done some odd research that in fact that people who were caregivers sometimes called it the withering. And this was in the 70s with people who were needle users, and sometimes with queer men would lose weight that couldn't be explained. But in fact, what happened is I did watch, and around me, all of a sudden, GRID, which was an early acronym for gay-related immunodeficiency, I think it was called. And of course, it wasn't just gay-related, and it turned out to be much more than that. And then it got, the term AIDS was more or less invented. As I started seeing friends and lovers begin to sicken and die over the 80s. I'm a journalist, and partly what we were doing, I was at the Village Voice in New York then. We were trying very, very hard to not to do necessarily medical reporting, but to do reporting about how this terrifying situation was going to be affecting everybody, and what was there going to be any response? I've written recently about grief because I continue to grieve my lovers and friends and colleagues who died, and they're in my dreams. Happens all the time. By the way, I cry all the time, so don't worry about that. I cry at the drop of any hat. But I did find out when PrEP was basically invented. I was walking with a friend of mine who actually is a sexual therapist, but was a journalist too, through an art show in New York done by people who did die of HIV-related causes. And we knew some of these people, and we were both in tears, Don and I. And he said, you know that PrEP, and we just found out about PrEP, it was something that would have been considered a serious miracle at the time. And we both got on PrEP right away, as soon as we possibly could. And I moved my caregiver, Jeffrey is his name, another one, moved me to Descovy because he said it would be better for an older person like me. And we know it's better in some cases for cis women and trans men. And we know a lot more about it now. And now I know there are injectables, and the new injectable, which is, I got to read it because I haven't memorized it, lenacapavir, the one that you need twice a year, is seems to be pretty amazing if you can get it. Apparently it's very difficult to get.
I'll pitch it to you, Shane, again, because I think we just talked about, exactly how there are several different kinds of PrEP that have evolved over the years, and just kind of give us a quick rundown of how there's different options that might fit different people's needs.
Yeah, so like Jeff started to allude to, the originally PrEP was just in pill form. It was Truvada was the first one that came out, and then followed by Descovy more recently, but still a number of years ago, was approved for PrEP. And then most recently, these past few years, they've expanded to have injectable forms of PrEP. So long-acting injectables like Apretude is the first injectable that came to market. That is like an every other month injection, and the most recent being Yeztugo, the every 6-month injection, which is still so new that it is very hard to get either approved through insurance or what have you. But yeah, so depending on whether you have particular like aversion to needles, or you forget to take pills, and needles would be better, there are a number of different options for you. And you can talk with your healthcare provider and have a conversation with them and see what would be the best fit for you.
Perfect. While I have you here, Shane has to leave a little bit earlier than the rest of us, so I'm going to ask him a couple more questions just to make sure that we get those out of the way, and then the rest of us can continue on, just because I want to make sure we get him in. Shane, talk about in general the effectiveness of, correct me if I'm wrong, but I think that all of the forms of PrEP are fairly similar in terms of their effectiveness. I know they differ a little bit in terms of side effects, but I guess start with general effectiveness, and then side effects we know not super common, but when they do come up, how we kind of track those and with lab work and stay on top of that to make sure that regardless of it's a safe experience for people.
Yeah. So all forms of PrEP that exist are highly effective at preventing HIV transmission. They wouldn't have been approved for such if they didn't demonstrate such a powerful ability to prevent transmission. The key is, though, that they must be taken as directed and taken properly. So with an oral daily pill, if adherence is not your thing and you're missing pills left and right, it does interfere with the overall effectiveness and increases your risk for treatment failure. Same thing with the injectables if you're missing the injections. But like I said, the nice thing about the injections being long acting, it reduces the amount of times, amount of doses you need in a year, and really you just need to remember to come into the office and get the injection a few times a year. So everything highly effective as long as it's taken as it's directed for PrEP. Side effects, they vary. Everything is very overall well tolerated by the vast majority of people. Our oral options mostly come with a little bit of nausea, upset stomach, possible like diarrhea when starting the medication, maybe some headache and whatnot. But again, super well tolerated overall. And if side effects do happen, generally they resolve after the first couple weeks when your body kind of adjusts to the new medication. And with the injectables, Apretude is the every other month injectable. That one is an intramuscular injection into the gluteal muscle on your butt. And so that, that and Yes2Go, which is a subcutaneous injection into the skin of your abdomen or your thighs. Anytime with an injection, it's injection site reactions, so soreness, tenderness, redness at the injection site. Those are typically worse the first few days after the injection. Also worse with the first injections. The longer, they found the longer you're on this therapy, the more used to it your body gets. So the frequency of those side effects really kind of tends to trail off after a while. And what there was something else I think you
Yeah,
asked.
well, it just, and then the other thing that we like to monitor is obviously on a routine basis, we like to have people do the lab work, and not like to, I mean, it's part of the requirement to stay on it, but just talk just a little bit about, what we're looking for there.
Yeah. So with any of the PrEP options, the biggest thing, the point of this medication is to protect you against HIV, keep you HIV negative. So one of the key things is to get an HIV test every so often. With the oral meds, it's every 3 months at least. And then with the injections, generally we go with every time you get an injection. There are guidelines, and our team here is very strict about following those guidelines. So the importance of staying HIV negative, or making sure that you're HIV negative, because these medications are also technically, they have their origin as medications to treat HIV, but these medications alone are not a complete HIV regimen. So if you happened to be HIV positive, you would not be getting fully treated by just being on this medication. So that's one of the big reasons that we need to make sure you're continually HIV negative while receiving this therapy. And then the oral options like Truvada and Descovy, we just want to make sure we check your kidney function periodically, at least every 6 months to a year, and make sure that it's not harming your kidneys. Some other potential long-term side effects could be with bone density and whatnot. So all of those things are actively monitored by a provider at the proper intervals.
Perfect. And then I have one last question for Shane, and then we'll let you go and move on. But we like to talk about, whenever we talk about PrEP, we also like to talk about PEP, which is post-exposure prophylaxis, where PrEP is pre-exposure. Shane, talk a little bit about what PEP is for, and I know Trillium, we're in a unique position in the Rochester area to be able to deliver that 24 hours a day. But tell us a little bit about PEP.
Yeah, so as I said before, PrEP is pre-exposure. So before you have an exposure, that's if you feel like you have an ongoing risk for HIV transmission. And then there's PEP, which is post-exposure prophylaxis. So that's in the event that you're not on PrEP or your adherence isn't great, and you have a potential exposure. You have an unprotected sexual encounter or a needle stick or something. And this is just similar to PrEP. It's a medication or a combo of medications that you take for about a month after the exposure. And the key is that you want to get on it as soon as possible after the potential exposure. The sooner the better, ideally within 72 hours. Fortunately, in New York State, we do, New York has made emergency PEP an option. So our clinic and pharmacy really jumped on that as soon as that became a thing. And our pharmacy does offer the 24-hour access to emergency PEP. And what that entails is just if you have an exposure, no matter the time of day, you call our phone number, and it gets it to the on-call provider, the on-call pharmacist, and they dispense a 7-day supply of the medication up front to get you started as soon as possible. And then we just get you in linked to care with a provider within that week to be seen in the clinic. And at that point, we get you the remaining 3 weeks of medication for that full month of therapy.
Perfect. All right, Shane, thank you so much. I think
thank
that does it for the nuts and bolts side of what this of how this works. Ember, I think I want to come to you next because we heard from Jeff's incredible perspective of being able to access this incredible resource to prevent HIV after living through the AIDS crisis. For somebody like me, and I imagine the rest of us on this call, it's hard to even fathom what those days were like. But, knowing that we didn't have to go through that and have this incredible tool available to us for pretty much most of our adult lives. Tell me about what PrEP means to you.
Yeah, thank you. So I'm Ember. If I haven't met any of y'all, I use they, them pronouns. So PrEP for me has given me a lot of peace of mind. I've got a number of mentors and friends in my personal life in the LGBTQ community who were alive during that time and have shared their perspective, shared their stories, and many of the difficult moments that I was not alive to see or experience. And that has certainly given me a lot of perspective and appreciation for the journey that this community has been on, and for everyone who is using PrEP has been on. So that has really been helpful and provided a lot of comfort in my life, knowing that because I am using PrEP, that I feel healthy and feel that I'm in a good spot in all my interactions and encounters with folks. And that really takes a big piece off the plate when it comes to concerns around sexual health and safety.
Yeah, absolutely. Shane talked about, kind of the requirements for it and the different types and things like that. But talk about, for your experience and only, what you're comfortable sharing. But, I think sometimes when people aren't familiar with a drug, they haven't been on it before, don't know how it works. Or maybe they have been thinking about it, but just really haven't talked to a provider about it. Sometimes it can seem intimidating, but I think for this, one of the things that surprises people is how easy the whole process really is. Can you just kind of walk through, what the process was for you and, that kind of that ease into it? Really, it wasn't as hard as people think it might be.
Absolutely. So one of the great things about receiving services here at Trillium is that process and how easy it was to transition on to PrEP. And what a great team we have here in the clinic who were there every step of the way to facilitate that process. So I had heard PrEP thrown around a few years back, probably about 3 years ago, and I wasn't well educated on the subject. And I was looking to learn more. And so I actually had a conversation with my provider here about it. I saw some of the literature that we keep available in the clinic public spaces and in the rooms themselves. And so that started a conversation because I saw it out there. I had heard the word being thrown around in the community. And I was curious to learn more on how that might impact my own life. And so that conversation was very easy, very open. My provider here at Trillium was very knowledgeable about that process, answered my questions, and helped me navigate both the anxiety of starting any new medication, but also what to expect and what that process looks like in terms of regular follow-up, blood work being done, and all of that. And since Trillium also has pharmacy services right here, that was another really easy step that once that was taken care of and we decided it was the right move to go forward with, that I could get my medications filled right here. And within 2-3 days, we were ready to get started. And it's been fantastic and a great choice for me and for my health. And I know that we have been able to connect so many folks through both our clinical and pharmacy services here with PrEP and the other forms of coverage and medication here. And so I think that's awesome about my experience with Trillium. I come in, I get my questions answered. The process is not challenging to start. If you have additional questions or follow-up, that was also very easy to get those answered in a good time and with great answers. And then certainly that the medications are just across the hall when they're ready for you to pick them up. And that whole process has been really seamless. You can tell the team here is well informed and is really passionate about making sure that everyone who feels PrEP's right for them has access to that.
That's great. And I think, you were a perfect example of how it should work. You see the marketing, you see the information and are educated and ask about it and get started on it. And I think, that's the ideal thing that we'd like to replicate. And I think we've seen a lot of successes, but we have a lot of work to go. Terrence, I want to get your thoughts on, PrEP in general, but also kind of the work that we still have to do. I think you're in a unique position, being at the MOCA Center and seeing, such a wide group of people come through. And I think, I don't want to put words in your mouth, but I'd imagine, there's certain people that know about PrEP and embrace it. And I think, but also there's people that either don't know about it at all or where we still have some work to do.
Yeah, we still have a lot of work to do in terms of educating the masses about PrEP. I feel like when PrEP was first introduced, it was heavily marketed towards the LGBT community. So there were so many groups of people that missed out. And now you see it in the numbers now when you look at the number of Black women who are not on PrEP. And not even, look at the number of trans women, the number of trans men that are not on PrEP. So I really enjoyed the tagline last year that PrEP is for everybody, because when we were doing the Prepperware Week, we had people coming in, oh, well, can I get on PrEP? I'm a trans man. Yes, it's for you. We had women coming in, can I get on PrEP? I'm not gay. One of my closest friends, she had no idea that she could get on PrEP, and she was just like, well. She's like, well, I'm a cisgendered woman, and she's like, well, I don't have a lot of sex in this, and I said, it doesn't matter if you're having sex once a year. I'm like, if you are active, I'm like, your gender identity doesn't mean anything. I'm like, PrEP is for anyone, I'm like, and you are a Black woman. I said, so you really should consider getting on PrEP. I said the HIV numbers in Black women are continuing to rise. I'm like, so I would much rather hold your hand and walk you through the door of the Trillium and, see you, get on PrEP and, get all your questions answered than not. And I think so. I think the biggest thing in working with communities of color is that stigma is so deep rooted. There are certain things that, within our community that you just don't talk about. Certain things you just keep to yourself. Medication is one of them. So there's always this stigma around HIV, AIDS, taking medication, who's sick, who's not. And so until we as a community, until we as a people, combat that stigma, we're always going to be kind of stuck where we are when it comes to things like PrEP and PEP, where I can have 20 people come in the door right now into Mocha Center who know about PrEP, who know they can benefit from it. But when it comes to getting them from the Mocha Center over to the clinic, to getting the PrEP started, that's when the issue comes. Oh, well, I have to go to work. Oh, I don't have time today. Oh, can I make an appointment? And it's stigma, and it's not just a stigma, it's also people are scared. What is it going to do to my body? What is it going to do? And so we do our best to educate them, but we're unlicensed. We're unlicensed staff here. So we say, hey, we can talk to you about this to the best of our ability. Yes, we know about the products, we know about PrEP, we know what it does, but the questions that you ask them, the questions that you're asking, they're more suited for a medical professional. Let's get you over to our clinic. And so, but I'm so grateful that we are connected in a way that we can, that we have access in the availability to start people on same day preps. But we're still pushing it. We're still, promoting it and still trying to get our people on it. So.
Yeah, I like that recurring theme because I mean, you brought it up, Ember brought it up as well, and Jeff, I know we talked about this as well. The importance of having, such a good relationship with your provider, and I know that that's not true for everybody. We like to think that especially here at Trillium, we have a wonderful group of providers that really do have deep relationships with their patients, but we know that may not be the case for everybody who's watching the video. But if you can find a provider or anyone in healthcare that you can trust and have that conversation, and take that proactive step about having a healthy sex life and being upfront about that in your healthcare appointments, it really goes a long way. And Jeff, again, we've talked about the wonderful provider that you have, and that open dialogue. Just tell me about how that's benefited your experience.
Well, it's amazing. Well, it took. I mean, I have a long medical history that's not just about HIV, but I'm a type 1 diabetic, and I have been since I was 8 years old. And I learned a long time ago that I had to ask questions. Otherwise, I would actually get wrong information or wouldn't understand exactly what was happening or what to do. And people, I talk a lot to older people now about how they shouldn't be afraid. If their provider is not going to answer their questions, they have to start, or they're scared to ask. I've gotten some information from people about what might make things easier. One of those things is if you don't have a friend who can go with you, a friend or a partner, anybody close to you who can go with you to see your provider, your regular provider, or maybe in an area there aren't very many providers and you've only got a couple of choices. You can also make a list with your friend of talking points, what you need to know, what you have to ask. And that actually calms people down, just the writing of it. And I think that that's something good for me to remember. I'm around good doctors all the time. I'm old. I got other problems, but I need to calm down, to make a list, to make sure that every, like, my person who looks at my heart, my cardiologist, is in touch with my regular caregiver, who happens to be, just because he happens to be, an HIV expert. And they are in touch about, are there going to be drug interactions? But you really have to, what Terrence said is true about older people in a different way too. That there's a scaredness, or they feel as if because I'm old, I don't want to talk about sex. A lot of people don't think old people have sex.
Go down to Florida. The STI rates in Florida are extremely high.
Yes.
On some of the retirement and some of the retirement, I was gonna call them compounds. So some retirement areas really, really high. So
yes, and it's true, and we are having sex. I mean, I'm in an open relationship. I have a husband who's a young man who's also we're both on PrEP. I mean, we're open. And we think it's important for people to love people and to have what anybody who wishes to should be able to have sex healthfully and affordably. which is another problem we haven't talked too much about. Our healthcare is not always up to, the insurances are not always up to snuff in that respect. Let me just tell you one other thing. I was at a gathering the other day, mixed people, but people who are mostly journalists like me, and just it was a birthday party. And I was talking about what I was writing and what I was doing, and I mentioned PrEP to them. I can't tell you how few people, and these are smart adults, not too many of them queer, but they don't know what PrEP is. They didn't know what it was. Got a lot of work to do. It's depressing.
I think that's the interesting thing, because I think there's certain segments, especially in the LGBTQ community, who have really embraced it, and it's become the norm. But I think like you said, there are whole groups of people that whether it's along cultural lines or age lines that don't know. And I think you also bringing up, there is still stigma, and I think that we always think of New York City as a more open, liberated thing, but it sounds like you're seeing that those barriers exist everywhere.
People, number of people I know and I just have spoken to, and also the doctors I talk to, tell me that people under 35 or 40, many people, all types of people, don't know what AIDS was. Just don't know. AIDS, what's AIDS? I can't believe that when I hear it, but it's true.
Yeah, Ember, I'm curious to get your perspective on that, kind of being in that age group that Jeff just, that talked about, that younger demographic. What are your thoughts? Do you think that the younger people being further removed from the AIDS epidemic have kind of lost that perspective a little bit?
I think it depends on what community you're interacting with. At least for myself, when interacting with other folks around my age who are LGBTQ, those folks have certainly not forgotten or not heard, right, or learned some of the stories, experiences of that time. But in the larger general public, for folks around my age, I definitely hear what Jeff is saying in that regard. I've got some of my closest friends who are cis or heterosexual, who, when I bring PrEP up, are like, PrEP, what's that? Right. So I certainly know a number of folks in my personal life who have never heard of PrEP until I bring it up, or bring up the work that we're doing for this, this campaign this year. So certainly, I think that it depends on what community you find yourself interacting with. But especially out in the more general public, I certainly would agree with Jeff's perspective there, that there are many folks who haven't heard of PrEP. There are many folks who have not even really interacted with the history around HIV and AIDS, and the time from the 70s and 80s up until now.
I'm old enough to remember that Elizabeth Taylor was the first famous person I heard actually say the word AIDS. And I'm also old enough to remember when Magic Johnson gave the press conference announcing that he was HIV positive.
Right.
And so when I think about 2025, I can't tell you the last time I heard a celebrity mention the word AIDS. Like, I can't tell you the last time I saw any concert or anything, any big charity or anything, for like HIV/AIDS that was along the lines of what they were doing back in the 80s. Like, it didn't disappear. It hasn't gone anywhere, and people are still definitely suffering. And even back to Jeff's point, there are people right here in Rochester that can't afford a PrEP. There are people right here in Rochester that can't afford their regular HIV meds, and thank God for places like Trillium,
Yes.
That provide those medications and provide those resources regardless of ability to pay. But yeah, I mean, personally, I remember I had an uncle that died from AIDS, and because I was raised in the South, you didn't talk about that stuff then, especially in the 90s. So they told us he died, it was cancer. It wasn't until I was an adult that I was able to put two and two together and say, oh, well, that wasn't cancer. And then, verify that, one of my aunts said he died from AIDS because he was an IV drug user, a heavy IV drug user. But it's those type of stories that need to be told. because you tell those type of stories, you never know who you're helping. You never know who you're helping to seek treatment. You never know who you're helping to get on meds or to even stay on their meds, and or to seek out something like PrEP. Hey, I'm an IV drug user. Maybe I should go seek out this thing called PrEP because, um, yeah, we still have so much work to do, and that's why places like Trillium are important. Things like Prep Aware Week is important, and Jeff, thank you so much for sharing your story. So inspirational. So
Well, it's great to hear from what you have to say, and the work that everybody's doing there is, I mean, amazing. I mean, I wish there were trilliums everywhere. Um,
absolutely,
I mean, because I mean, my issue, I mean, I've been interested in health for my whole adult life, but my issue is that I'm on Medicare, and the what they used to call a catch-22. Maybe you're all too young to know what that is, but it was that we need, as the pharmacist said, um, uh, you needed for the pills to be tested for HIV every 3 months. Medicare would pay for testing only once a year. So you had to find workarounds all the time for all of this.
yeah,
And places like GMHC, Government Health Crisis, there are other places, clinics and organizations that can do that, but that's not enough. This is,
yeah,
there are millions and millions of people who need this help, and they're not
mhm,
getting it. So I fight for that. We're fighting to get covered. And the injectable, which I'm interested in, I would like to switch to that. Um, no, my caregiver, who's an expert in this, he says he's got 2 patients who want it. He can't get the insurance to cover it. So that's a fight we have to fight. We have to fight for funding. Everybody. That's what
Yeah.
partly what I want to do.
Yeah, absolutely. I think, it's we still have, as Terrence and as everyone has said, we still have work to do. There's in terms of improving access, in terms of improving education. You can't access resources like this if you don't know about it, and obviously there's still a lot of people who don't know that PrEP is a good option for them. I think we've covered so much ground. I think that in that spirit, as we wrap up, you know that kind of final message of what PrEP means to you, and kind of that peace of mind that it offers. If you were to I think in many ways it sells itself, but if you were to talk to somebody who maybe was on the fence or didn't know, and just wanted to again reiterate what PrEP means to you in your personal life, and to maintain your positive sexual health, and empowerment, what that means for you. And Jeff, we'll start with you.
Okay, well, um, ever since I started taking PrEP, I realized that I could feel safe in myself. Um, and and also it made me think of my friends who died. And HIV meds are also very important. My oldest best friend, who is named Melvin, he's lives in San Diego. He's here in New York now. He's my age, and this saved his life
mm,
and his husband's life too. I want to live a productive, happy, sexual life, and PrEP allows me to do that.
Beautifully said. Ember, what does PrEP mean for you?
I think here on the local level in Rochester with Trillium, that peace of mind and being so localized, and that Trillium provides so many other services around PrEP, that it's so accessible. And certainly, right, as both Terrence and Jeff brought up, we've got a heck of a lot of work left to do here, and that journey may very well never be done. But here at Trillium, everything being in one place. And I would say for someone who's not sure, talk with a provider. If you want to come talk with someone at Trillium, we have staff who can do that to support you and have that conversation. There's never any push that you have to do something. There's no rush. there's always, let's talk about it. Let's see if it's right for you. Let's talk about some of your questions, concerns, anxieties. And that's navigated so professionally, so openly, and so respectfully of each individual's background, that I really have felt super comfortable both privately with my experience here, but also then publicly speaking about it as well. So if you're not sure, reach out to someone at Trillium, reach out to a provider here, come by the clinic and ask to speak with someone a little bit more about that process and that medication. Our pharmacy team is marvelous as well, right? And through all of those different resources, I really appreciate the work that Trillium does here to make PrEP and those other related medications more accessible to our community.
And Terrence, your closing thoughts on
Yeah, for
PrEP.
me, PrEP is taking a stand against stigma, especially for minorities and communities of color.
Yeah. Well, this has been a really great, conversation. I think just so much fascinating perspective and lived experience. And I thank you all for, participating and sharing your story. I know sometimes that's not easy. But, I think that this shows, the power of telling these stories and helping to educate more people about PrEP as a resource and how it can really, make such a positive impact in so many people's lives. And it goes to show that we all can be. We have two PrEP Aware Week ambassadors with us officially, but we all can be, PrEP Aware Week and PrEP ambassadors. And join. I just realized I didn't even mention this year's theme, but join the PrEP revolution, which is our theme for PrEP Aware Week this year. And again, just continuing to spread the word and connect, people, let people know who may benefit from it. Let them know so that they can get access to it. For people looking for more information, if you're in the Rochester, New York area, for Greater Rochester, Finger Lakes area, and are looking for more information on PrEP or get connected to care here at Trillium, we're a click or phone call away. You can learn more information and get our phone number at trilliumhealth.org/PrEP. If you're outside the Rochester area and other parts of New York State, or even outside of New York State, and are just looking for more resources and information on PrEP to then take to your own provider wherever you may live, a lot of great resources on the PrEP Aware Week website, which is run by the New York State Department of Health's AIDS Institute, and that web address is prep4sex.org. So again, thank you. Thanks for participating in this. This has been a great chat.
Thank you.
And we look forward to PrEP Aware.
Nice to meet you also, Jeff.
Yeah, thank you, Jeff. Appreciate it.
Until PrEP Aware Week next year. Thanks again, everyone.
Have a good one.
Bye-bye.
Have a good one. Bye.